Coast. The dog had sat under that high chair every single day for 8 months. The morning he didn't, it was the only warning they were going to get. Coast. Juniper Hollow's cell was 13 months old, the age where everything goes immediately and indiscriminately into the mouth. She sat in her white high chair with the look of someone deeply committed to smearing sweet potato into as many unreachable places as possible. Coast. Her father Cal stood at the counter with coffee he had not yet had a chance to drink. The golden retriever Chester lay directly below the high chair tray in his usual position. Head between his paws, eyes angled upward toward the trajectory of anything that might fall. Coast. This was the routine. This had been the routine since the day Juniper first sat in the high chair and discovered that throwing food downward produced a dog. Oast. Chester had arrived for every breakfast, every lunch, every dinner, unfailingly without instruction or invitation. He was a floor-level safety net, and everyone in the house had accepted this arrangement completely. Coast. Cal's wife, Priya, worked rotating hospital shifts as a radiology technician. This was a Tuesday morning, and she was home, sitting at the kitchen table with her own coffee, on the phone with her mother, in a conversation that required most of her attention. They were an ordinary Tuesday kitchen. Nothing was remarkable. Coast. Until Chester stood up. He did not stand up because something fell. He stood up before anything fell, rose from his position under the chair, stepped aside and sat directly on Juniper's feet, the baby's bare feet, which dangled below the high chair footrest, and would not move. Juniper looked down. Coast. His nose was working in a way Cal could see from across the kitchen, rapid and fine, reading something in the air between them. Cal watched this for 10 seconds. Then he said to Priya, "Chester is doing something weird." Coast? Priya put the phone against her shoulder. Chester had both paws on Juniper's feet now, nose raised toward the high chair tray. Juniper was holding a piece of scrambled egg. She had had scrambled eggs before, many times, without incident. Coast. What was different about this morning was that Priya, trying a new recommendation from a pediatric feeding group she'd joined, had added a small amount of sesame paste to the eggs for nutritional value. It was Juniper's first exposure to sesame. Coast? Chester had been in the room when Priya prepared the eggs. He had been 6 feet away when she mixed in the paste. He had been paying attention to the tray from the moment Juniper's first bite went in. Coast? The first sign came 6 minutes later, a redness at the corner of Juniper's mouth, small and fast, spreading the cheek below. Cal noticed it because Chester was standing now, both front paws on the high chair footrest bar, nose toward Juniper's face, making a low sound that was not a bark and not a whine. Coast. Something in between. Something that had no routine name. Priya was off the phone. She was at the high chair in 8 steps. She looked at Juniper's cheek. She was in the car in under 3 minutes. Coast. Drive Valeria Kwan, pediatric emergency medicine, assessed Juniper at the clinic and administered epinephrine 14 minutes after the first visible symptom. The reaction was classified as moderate severe anaphylaxis. Coast. Sesame allergy in infants, she explained, presents rapidly and escalates in a nonlinear way. What looks mild at minute 3 becomes airway involvement in minute 12 without intervention. The timing of intervention in this case was, in Dr. Kwan's precise words, exactly right. Coast. If you stay for stories about what animals sense before we do, you are in exactly the right place. Subscribe so you don't miss the next one. Coast. Sesame produces a specific volatile signature, a combination of furans and aromatic compounds, detectable to a dog at concentrations far below what human olfaction registers. Chester had been reading Juniper's breathy air around the tray and the combination of what was in front of her since breakfast began. Coast. When the interaction between the allergen and her system began, the earliest pre-symptomatic stage of allergic response, he had moved. Coast. He had not moved to the feet because he wanted attention. He had moved to the feet because it was the only position from which he could make contact without knocking over the high chair, signal the adults without leaving the child, and keep his nose close enough to keep reading what was happening. Coast. He stood on her feet until Priya walked in the door. He stayed until Priya had Juniper in her arms. Then he stepped back, he looked at Cal. He went to his bed. Coast. Priya thinks about this in the mornings now. The specific difference between Chester lying under the chair and Chester standing on Juniper's feet. 8 months of one behavior and then the one morning where something changed in what he was reading and he changed accordingly. Coast. Priya works in a field built on imaging, on finding what the eye cannot see in the image the machine produces. She thinks about what Chester was imaging that Tuesday morning and comes to the same conclusion every time. Coast. Has your dog ever behaved differently around your child's food, approaching, avoiding, or alerting near the tray, for no reason you can name? Tell us in the comments. These stories deserve to be heard. Coast. Juniper has a confirmed sesame allergy. There is an epinephrine auto-injector in her bag, in the diaper bag, and in the kitchen drawer. Chester still sits under the high chair at every meal. He is patient, methodical, and reads the air the same way every time. Coast. Every guardian deserves to be recognized, even the ones who never ask for anything in return. If these stories matter to you, subscribe so you never miss the next one. The difference now is that Cal watches him back.